There's been a tremendous amount of interest in fillers to help restore a youthful facial appearance. Most of that interest really has been focused on women. And there's no question that fillers in various parts of a woman's face have a significant potential for improvement. One of the things that I've learned over the last couple of years in utilizing fillers a lot is they've got a very effective role in the male face, in a man's face. I think that due to the fact that men have bigger bone structure, they don't gravitate or age in the same way women do who have smaller bones, especially looser skin, that the volume loss is probably more significant in men than in women, more than we ever had perceived. And therefore, utilizing fillers in a man who has thicker skin and therefore can allow for more volume restoration without the palpability or feeling has a very significant improvement. And I found that, to my surprise, men are in many ways better candidates for fillers alone without lifts than women, who oftentimes need a combination of both volume restoration or fillers and some sort of anti-gravitational lift. With regards to the type of filler used in men versus women, when we're really talking about robust or significant volume restoration, I tend to use fillers that have higher particle size. I call them more robust fillers. Those are also the same fillers that last longer. Women frequently come in more concerned about fine lines. Women's skin is thinner and therefore are utilizing a lot of the larger particle size fillers have an increased risk of palpability. So in women, I do more of a combination. Larger particle size fillers deeper, more superficial, delicate particle size fillers more superficially, where in men, I'm using more filler and larger particle fillers to gain more volume restoration. I think fillers are a critical part of restoring the aging face, if you will, but they're not the sole component. I think every individual needs to be addressed as to how much of their appearance is related to gravitational changes, and that usually needs to be treated with a lift of some sort. How much of the face is aging process is due to deflation or a loss of volume, and that component needs to be treated with fillers. And how much is a skin elasticity problem, where we need to focus more on peels and lasers and dermabrasions and that sort of thing. When you evaluate the face in toto, you can then determine how much of each component needs to be treated so that you can get a natural appearance, not one that is overcompensated by one versus the other and not a distorted look. The people that best do that are board-certified plastic surgeons because they know all three aspects of the process. They're trained by people who have studied facial aging not for the last 5 years, but for the last 50 years. And therefore, there is a perspective that many other physicians can't bring to the table.